Hello and welcome. You're watching India Fights Back with me, Rajat Kain. In this episode of show, we'll discuss about the issues concerning bone health among those infected and recovered with COVID. Now, many COVID recovered patients are reporting aches in their joints, hips, shoulder, and even on the knees. The condition is called avascular necrosis or AVN, or death of bone or joint, if not managed in time, could lead to a devastating results. Now, doctors say as of now there is no government data, but hospitals across India are receiving such cases with patients largely belonging to age group of 30 to 50 years coming up with such complaints of aches, and of course, after discovery, it's found that there has been some degeneration in the bones. Now, discuss further on this issue and how important is it to not ignore the first or the initial signs and straight away consult the experts. We're joined with Dr. Shubhang Aggarwal. Many thanks, Dr. Aggarwal, for joining us. He's Senior Surgeon, Joint Replacement, NHS Hospital, Jalandhar. And Dr. Arun Sharma, he's Professor, Department of Community Medicine from UCMS, Delhi University. Many thanks, Dr. Sharma, for joining us. Let me start with you, Dr. Aggarwal. So, how often are we seeing people who have recovered from COVID coming up with, issues concerning pain in their joints?
Okay, so we are seeing actually a lot of patients. In fact, almost, our routine OPDs have double the number of patients who are presenting with joint pains, and most of these patients have recovered from COVID. In fact, you can say that in all COVID recovered patients, there is some or the other muscle or bone pain.
Right.
And what we are seeing is that one is because of any kind of viral infection, you tend to see some sort of bone pain or muscle aches, like what you call a post-viral arthralgia or a post-viral myalgia, which is joint pain or muscle ache. But specifically on the hip joint, we've realized that the incidence has almost doubled. Almost every week, we are seeing 2 to 3 patients who have been treated for COVID-19 infection with high-dose steroids, which was actually a lifesaver at that time. But unfortunately, their hips have been affected and the blood supply to the joint has been cut off.
Right. So seriously, this is one situation that is fairly alarming. Dr. Arun Sharma, what are the first signs that any COVID patient or the one who have just recovered from COVID should pay heed to whenever it comes to joint aches?
So, as Dr. Shubhang said, I will be adding to that, that everybody who has suffered from COVID-19 and has been treated with steroid should be alert to the possibility of developing avascular necrosis and occurrence of any kind of pain or in the joints. So, pain in the joints or in the bones should not be neglected, whether it is on the large bones like hip or knee, or it can be even on smaller joints. That should not be neglected, and immediately they should be alert and get consultation with a doctor, their physician, or an orthopedic surgeon to find out whether actually avascular necrosis has set in or not.
Okay. And usually, Dr. Arun Sharma, what would be the time frame? Why I'm asking, say whenever we are afflicted with any disease or any, any sort of a problem. So usually after 1 or 2 months, we are fairly off guard and say, okay, fine, the worst is behind us. But for this particular symptom to recur, how much, what sort of a time frame does usually are we seeing?
See, the COVID-19 related bone pain or avascular necrosis is a recent development. We have started seeing cases now. So it's not really possible to say what time frame we should look at. But as the pathogenesis of the disease goes, usually the changes happen in a slower manner. And maybe after a period of 3 to 6 months, such symptoms start appearing. So we have to be alert, as you rightly said, that we should not become complacent, that we have recovered and we are absolutely fine after 2 months or so when we start physically feeling fit. But at the same time, immediately after that, if such symptoms of pain or difficulty in walking or difficulty in using our limbs happens, we should be alert to that. And immediately treatment or care should be sought from the doctors in this regard.
Dr. Aggarwal, I'm sorry, really sorry. Dr. Aggarwal, the patients that you must have seen in a hospital with post-COVID complications and AVN in particular. So, what has been duration of these patients who have recovered from COVID? How much, how long after the recovery does these symptoms start appearing? I mean, the same question I asked Dr.
Yes,
Aggarwal. Yeah.
Yes, I think like Dr. Sharma said, it doesn't happen immediately. So initially, a COVID-treated patient will have some muscle aches, some joint pains, because of the infection per se. But most of the patients that we are seeing now were actually treated in the first wave. I'm yet to see a patient who was treated in the second wave and has already developed an avascular necrosis of the hip. So it's unlikely that it happens in the first 3 months or first 6 months. In general itself, avascular necrosis is not a new problem. Avascular necrosis takes almost 6 months to 18 months to set in after high-dose steroids. So people who were treated in the first wave with high-dose steroids, or we are also looking at the possibility of a thrombotic complication of COVID. Like you must have heard people were talking about clots developing because of COVID. So maybe there is some factor of clotting here, which is actually obstructing the blood supply to the bone itself. So imagine if there is a clot which has developed inside the hip joint blood supply, it cuts off its own blood supply, and then it lands up in avascular necrosis. But yes, most of the patients were treated with high-dose steroids, and they take at least 6 months for the symptoms to present. The idea is that if you have been treated for COVID-19 with high-dose steroids, and you have any part of the body aching for more than 15 days, which is sort of beyond your routine aches and pains, cramps and stuff, then you must suspect that there may be something wrong, and then you consult your doctor and get at least an X-ray done. Now, avascular necrosis cannot be picked up on a simple X-ray in the beginning. You need at least 40% of the bone to be destroyed already to see it on an X-ray. So an MRI, if there is a high clinical suspicion, we would suggest an MRI, and an MRI will pick up early stages of avascular necrosis.
Right. And in terms of the age group that we are seeing, there are reports that people between 30 to 50 age groups are the ones who have been found susceptible. Is it usual phenomenon in that age group, or is it something new again we're seeing?
Well, I wouldn't want to put an age bracket to this, but yes, most of the patients that we have seen till now with avascular necrosis of the hip joint per se have been between 30 and 60.
Okay. So, I mean, is it unusual to have such age group of people having suffered with AVN, or is it fairly usual phenomenon?
No, avascular necrosis otherwise also avascular necrosis would present in a similar age group. Those who used to take steroids for, let's say, a skin infection or maybe asthma, so the people who take steroids on a routine for long term, they get avascular, they have a tendency to develop avascular necrosis. But spontaneous avascular necrosis without any reason generally presents between 30 to 50. Yes, that's correct.
Right. Dr. Sharma, is it usually like what we're seeing post-COVID is the ones who have been on steroids, are they more susceptible, or even the ones who haven't been on steroids may possibly run into risk of having AVN in time to come?
Yeah, this is an important issue from 2 points. Number one, yes, if the patients who have been treated for a long period with steroids, they definitely are at increased risk. And when it comes to the question of this age bracket, we should also understand that the maximum number of cases of COVID-19 which required steroid treatment in our country also belong to the same age group, 30 to 60. So it may be an epidemiological or a public health paradox that we are seeing more cases in this age group because more patients are happening in the age group. So we cannot really say whether age is a confounder here or age is directly playing a relationship with the occurrence of avascular necrosis. Having said that, we also need to look at some allied factors. By allied factors, I mean, Dr. Shubhang already pointed out that the risk of vascular thromboembolism is very high in COVID-19 patients, especially in the recovery. And that thromboembolism can also cause avascular necrosis in a shorter period. For example, if these clots are developing in blood vessels, and these clots get lost in the blood supply of the joints,
right.
then the avascular necrosis will start immediately, and it need not be related to steroid alone. The third component is that in a severe viral illness like that, when people have suffered for a long duration, say some people took more than 30 days to recover. Some people were discharged from the hospital after 45 or 60 days of treatment. Now, this period, they have been absolutely immobilized, lying on the bed, and their diet was also not as balanced as it could have been. So this leads to bone loss. This leads to loss of the muscle, as well as the general immunity of the people is also lost. So all these factors also contribute to increasing the risk of avascular necrosis, increases the risk of happening of these symptoms like pain. Myalgia, for a patient, it's difficult to differentiate between a pain which is occurring in the joint or a pain which is occurring in the muscles and the tendons which are surrounding the joint. So he may confuse between the two. So that is where it becomes more important that the patient should remain alert to the possibility that the pain may be due to avascular necrosis, it may be due to osteoporosis, or it may be due to myalgia itself. And therefore, consulting a doctor becomes very important, that they should find out what is the underlying pathology so that the right treatment can be started.
Right, right. Well, that's important, right? Treatment is a key word in every, every post-COVID complication that we're seeing. And how do we get the right treatment? By reporting to right person, the experts. Well, this is something which we have been repeating here ad nauseum in our show. Dear viewers, you're watching this show, please listen to experts. I mean, our humble request, listen to them carefully. They are the ones who are fighting this pandemic for us. They are the ones who are treating, and only scientific approach, only and only a scientific approach can defeat this pandemic and nothing else. Do not hear any hearsay, any rumors about COVID complications, and even about vaccination. Well, shifting gears, sir, let's talking about the treatment of AVN. Dr. Aggarwal, let me start with you here, sir. Is it essential that straight away we require a medical treatment, or possibly any lifestyle change can also help us?
Okay, yes, definitely. In the beginning, first thing is to make the diagnosis. Once we have the confirmed diagnosis of avascular necrosis on an MRI, it is staged from 1 to 6.
Okay.
Now, let's say in the beginning, a stage 1 or stage 2 does not need any surgical treatment at all. So they need to protect the joint from overloading. They need to strengthen the bones by taking calcium, and they need to take a lot of vitamin C, which actually is said to promote bone, vascularity, blood supply to the bones. And then, strengthening exercises, and that's what it is. So in the beginning, but once the stage is beyond medical treatment, it always is some sort of medicine. So whether it is calcium, vitamin D in the beginning, or it's a more complicated medication called bisphosphonates, which can be tried for avascular necrosis. It is known to strengthen the bone in lesser blood supply also. And then later stages, if it goes beyond repair, then we will have to consider a surgical option.
Okay. Okay. Dr. Sharma, your take, I mean, straight away, do we go for the medical treatment here, or there are any lifestyle change that one would recommend?
No, I absolutely agree with what Dr. Shubhang said. It's very important that in the recovery phase for the COVID-19 patients, taking care of their diet, having it rich in calcium, having it rich in not only vitamin C, but all multivitamins and all micronutrients. They should be consumed in the right amount. Now, for the viewers, probably to differentiate between micronutrients and things like that is difficult. What the message should be, that eat a healthy, balanced diet, eat fresh food, eat green vegetables, have a lot of milk, have a lot of good sources of protein, and avoid eating any kind of junk food, because you need to build up your health post-recovery from the COVID-19. That is the first thing. And secondly, because we are in the recovery phase, there should not be over-exercise. We should not become too enthusiastic and start doing rigorous exercise, which we are not used to. That may be damaging for the bones and the joints. So gradually we improve our stamina, gradually we increase the exercise that we are doing, and try to live as healthy life as possible in the post-COVID scenario, so that we can avoid maximum number of complications. So maximum emphasis should be put on the right diet and the amount of exercises that we are doing.
That's very important point you have said, Dr. Arun Sharma, and I would like to underline that, we have to go for the optimum exercise, not like we just cannot what do I say? We just cannot overexert ourselves, and this is a phenomenon that we are seeing pretty often among the ones who have recovered. They straight away go for the jogging, running, or all sort of exercise, but clearly that is something which we have to pay heed to. Sir, Dr. Arun Sharma, just continuing with on the same vein, sir, how much stress, or rather the physical stress post-COVID is, we should be very careful about that.
Yeah, so I get a lot of inquiries in relation to this, that how much exercise we do, what do we eat. So that usually, it has to be individualized. The question is how much you can do, how much your body is permitting, and that varies from person to person. Right. It depends on how severely you were infected. During infection, how did you take care of your body? So what the body can tolerate, what the body can take, start with that. I will say that if you had been bedridden for 15 days, if you are up, then first you try walking only for 5 minutes and see whether you can tolerate this or not. Right. You start climbing a few stairs and see whether you are getting breathless or you are able to tolerate that kind of exercises. So it's all depends on your individual stamina and capacity, and then you gradually increase over a period of duration. Don't expect miracles to happen, that today you are out of the bed and tomorrow you are absolutely fit. COVID-19 is not a disease like that. So we need to take gradually, and whenever required, take assistance from physiotherapists, take assistance from your doctors who will correctly advise, given your situation, that how much exercise you should do, what kind of food you should be eating at that time.
Right, clearly. Dr. Shubham Aggarwal, sir, there are patients who possibly may have pre-existing issues concerning the bones and joint aches. What steps should they take so as to possibly avoid this, A, or secondly, if the pain increases, then what should they do?
Okay, so one thing definitely that COVID did was flare up anything which was existing, the weak point of the body, So if you had a back pain anytime, maybe in the last 3-4 years, after COVID, that back pain woke up again. Somebody had a knee pain, that knee pain woke up again. So it's like a reset, somehow it's like a reset of the body where it went down to that weakest point of the body, started paining again. So people who had, muscle aches or back pain or neck pain from before, they've all started having those symptoms again. We attribute it to COVID, yes, that COVID did it. But like Dr. Sharma said, it's easy to identify if they know that they had this issue. And they should start exercising, consult their doctor, and then, if there's any medication required, they would take that medication. And the rule is to start low and go slow. People who develop intolerable pain after COVID infection, let's say 1 month down the line, suddenly you start developing a back pain, and you realize that you never had this pain, but maybe 3 years ago you had one episode. Then you must see your doctor and get it checked whether it is actually just a weakness or it is related to lack of exercise or maybe over-exercise, and then take treatment for it.
Right, certainly. So these are things that we all need to take care of. These are things or suggestions, advice, as just discussed by our experts, that all those who have recovered from COVID infection off late or even last year, they should be on the lookout for these symptoms. Symptoms can be early symptoms. Symptoms can even develop later as we go past a recovery period. Well, many thanks, Dr. Shubhang Aggarwal, for joining us, Dr. Arun Sharma, to be part of the show. It's really invaluable to have you. And of course, like all that you have shared with our viewers is extremely, extremely important. Well, so that's it in this edition of India Fights Back. But before we leave, a small appeal to all our viewers. Dear viewers, keep following COVID-appropriate behavior. The pandemic is not over yet. Keep wearing a face mask. Please do not compromise on that facet. Keep maintaining sanitation around you. Keep washing your hands 20 seconds at least. That's what the expert says. And do not forget to maintain the physical distancing. It possibly can be difficult in certain places, but try as much as possible. Remember, these are small things that can help us in defeating this pandemic. Well, on this note, we sign off. Thank you. Goodbye.